All right, every pharmacy student dreams of passing that NAPLEX, but over the last decade, the pass rates have revealed a very concerning trend that we're going to tackle. Hey guys, I'm Dr. Busti, your faculty and host on This Is Why, a show that helps healthcare professionals transform their medical knowledge from the what to the why. The why here, okay, is centered around those factors that contributing to this decline. But more importantly, knowing the why changes the how, meaning how do you take this awareness and translate it into a strategic approach towards your success on the NAPLEX. At the end of this, I believe you will see what the factors are and have a clear understanding of what you need to do. Okay? We're going to beat this together. So be encouraged, right? Because you do have to do some level of control over the outcome. All right, so let's get on with it, right? What you see here is a table that I'll kind of orient you to it, but it's looking at the pass rate trends compared to also the number of pharmacy programs that are accredited in the United States, but also then how many students are enrolled, right? Because we have to look at the big picture. The reasons for the declines, which you can very clearly see towards the bottom, are going down. You probably heard about it. The reason you're watching this at some level is due to the fact that that's happening, okay? Now, over on the far left is the year. I went back to 1995, okay, and you can see that these are estimated. That does not consider all exam test takers. But then I went basically in some intervals by 5 years trying to get, perspectives, especially when it wasn't changing. So really it didn't change much for almost 10 years. 1995, all the way up to, almost 20 years, almost up to 2014, right? You can see basically a pretty decent overall performance. If it matters, I took it in 2001, so I was in this bucket over here, okay? So next thing that you see is the number of pharmacy programs, and one of the things that you see is that around 2014, the number of programs had really started to increase, all right? So in 1995, again, I started pharmacy school in 1997. So I was in that bubble right there, okay? Where about 28,000 or between 28,000 and 30,000 students were enrolled throughout the country, okay? So you can see that that number really started to pick up as you go down the years, okay? So in 2014, then we have 2015, and then something started to happen. You see that it started in 2014, it was 94%, stayed pretty steady, and then around 2015, it started going down, and then 2016, the profession had a wake-up call. I remember when this happened. I mean, it was like the sky was falling apart. I mean, it was bad. What has happened all of a sudden that the pass rates have dropped this far down below 90%? Right? You can see the number of pharmacy schools we're not totally at a doubling, right, at this point, but still growing. 63,000 students being enrolled compared to 28 to 30,000. So that's a pretty significant increase in the number of students. Well, after that, you can see that the trends just really kept going down, right? And so the trend down is what's concerning. And the other observation here is that as the trends are going down, the number of pharmacy schools increased and now stabilized. But look over here what happened to the enrollments. They keep dropping. So you have more pharmacy schools available that are accredited, but fewer students not only applying, but also being enrolled. Right? So the candidate pool, the applicant pool is very different. Okay? They're just observations. Okay? Now, obviously, in 2020, the World Health Organization, around March of 2020, that's when the COVID pandemic occurred. A lot of things changed then for, obviously, the world, but also the way students went to school and went to clinicals and rotations and the experiences they had. It's not a student's fault. They encountered it at bad timing. So the institutions and the profession also did some things to facilitate a balance in that scenario. And the NABP suspended its requirement of the PCOA exam, which basically never came back. Okay? The PCAT, which was that pre-college, so kind of like the MCAT for medical school, that got dropped and was starting to drop rapidly. So they were, in some sense, making it a little bit easier to not only get into pharmacy school, but there's also a question that maybe it was easier to graduate. So are people potentially graduating who are not the same people from back here, right? Then the COVID pandemic stopped or ended by the World Health Organization in May of 2022. But obviously, students that enrolled in pharmacy school in 2020 and in a four-year program are going to be graduating in 2024. So there's now this staggering of still COVID-related potential students taking exams. So the next 5 to 10 years is going to be interesting as the pandemic is over and hopefully nothing else happens. Well, the PCAT basically was retired in January of 2024. So again, we have this change in who gets into pharmacy school. What does that applicant look like? Even the number of applicants has shifted. So these numbers over here, 2.6, the ratio, it's supposed to be there 1, 3.6 to 1, 8.3 to 1. So right here in 2014, we had some of the highest number of people applying to pharmacy school. That was telling about the profession. It was solid, it was strong. People wanted to be a pharmacist. The job market was good. So people wanted to go, right? The competition was higher, more fierce. Well, look at the performance. Higher. So it was even harder to get into pharmacy school for other people than even when I applied. Okay? That has now changed. There are fewer applicants and fewer people actually being enrolled. So there are some programs that have a lot of empty seats, which it creates problems financially for the school, but it also doesn't go well for the profession as a whole, right? So these are just observations. This is just publicly available information. There's assessments of data. But you should reflect on that and understand this. But there's also something really also important to understand that's for some of you watching this who are getting ready to prepare and probably feel discouraged. Don't be. We're going to overcome this, guys. We're going to tackle these problems. That's why I'm doing this. To equip you in understanding why this is happening, but what you're going to do about it. In the days when I took it, everybody just assumed you're going to pass because almost everybody did. I mean, there were just a very few number of people that failed. That's changed. Okay? And I don't want you to be one of those statistics. And I think you can overcome it, but you've got to listen and come up with a strategy. But there's something that's also happened that is making it harder for those of you going through the programs now. And that's just the pure number of drugs and drug classes and things going on. The number of guidelines has proliferated compared to when I was in school. So, since then, back in 1997 and 2000, when that bubble I was graduating, there's been almost 1,000 new drugs, over 300 new drug classes, tons of disease states that got codified in guidelines. That's helpful, but it's a lot of information. Now, are you going to be tested on every designer drug out there? No. Right? Remember the top 200, top 300 drugs? But still, it's a lot more to have to know that core knowledge. And then to take it to the next level, which is applying that core knowledge at a level where you understand why you're doing what you're doing. So that it's not just fact-based memorization, it's application. Okay? And so I wanted to put this together for you, again, not to discourage you. Right? This can be fixed. We as a profession, and we as a member of the healthcare team, can fix this, but it requires you to be aware of the problems and what are you going to do about it. Okay. So what are you going to do about this, right? I mean, I keep bringing this up. What's coming up with a strategy and using resources and tools that are pointing you to the things that are testable, i.e. scored, can be scoreable, that not everything on your test is going to be scored, right? So focusing in on that validated information that it represents the standard of care across the country and in all environments. And that's one of the reasons why I developed high yield meta reviews, to create some of that pattern. It's also why we're doing This Is Why. We want to teach you these core concepts, but also not to just memorize a bunch of facts. Not to just carry around a book and read it and think that's going to solve your problem. It's not working, guys. And I've seen a lot of you carrying around books and thinking that's your solution. It is not. If it was, why are the scores the way they are? So you need a strategy of thinking and approaching things differently. And you're like, I'm tired, I'm exhausted, I just need to know what's on the test. I get it, guys. And yes, there is a part of playing the game and understanding the rules of that game. That's why I'm putting these topics out there for you. Right? But you've got to hone in and focus and study differently. You cannot memorize your way through the exam, and you cannot read a book to solve it. I hope I made that point clear. I've watched so many students fail because they don't have the right mindset and they're not being led to think that way. So I want to see you succeed, so I'm encouraging and I'm pushing you, all right? Because that's why we're here. I'm here to invest in you and other healthcare professionals to understand why, so you can master the how. And how do I study and how do I pass this test? Okay? Sometimes we want a very simple, easy answer and not a strategy. You need a strategy that's going to carry you forward in life, because you're never going to stop learning. In fact, you'll learn more when you graduate and get out in the real world. And that's exciting. It can be very rewarding, but it's also an expectation of you by the patient and by the state. So I hope you found this to be helpful, not discouraging, but motivating. And please join us and let us know how we can help you. All right? All right, guys, take care. We'll see you next time.